Joining us tonight. My name is Katie Barrett. I am a maternal health advocate in Massachusetts. You have a lot of Massachusetts advocates as part of the program tonight. And I'm a member of the planning team for this symposium and have the great honor of facilitating this breakout tonight. So I want to share a couple of reminders before I introduce our esteemed presenter, Dr. Smith. So firstly, just to help keep this experience a safe space for everyone together, please submit your comments in the chat box or use the question and answer key to submit the questions to us. I will be reading the questions to Dr. Smith in the last 10 minutes of the session to make sure that we have enough time for her to speak directly to you and your questions that you have of her. We're monitoring the comments, but again, please just be respectful, be honest, be yourself, but try to be respectful of each other in your comments and your questions. And maintain confidentiality. As Nikisha said in the opening, we are all here together as advocates to make change for maternal health. So those tenets of respect and confidentiality are really important for us to be together today. And then lastly, if you're following along on social media, please use the hashtags birth equity, PCOR, PCOR, and NMHPN, which is the name of this project. So without further ado, I am honored to introduce Dr. Sharla Smith. Dr. Sharla Smith completed her PhD in health services and system research with a concentration in health economics from the University of Arkansas for medical sciences in 2013. She is a health services and system researcher whose primary focus is women and infant health, specifically Black and infant mortality. She said today she just presented in front of the Kansas State Legislature, so she's an incredible advocate as well. She has over 7 years of experience studying public health delivery systems and their association with health outcomes, manipulating large data sets and performing descriptive cross-sectional and longitudinal data analysis, and conducting social network analysis. She also has over 4 years of experience in clinical research focused on multiple myeloma and breast cancer, so she's clearly very overqualified to be here with us tonight. She is most interested personally in understanding why certain health systems have better than expected maternal and infant health outcomes compared to their peers. She's interested in how to improve peer-to-peer sharing and learning and to reduce structural racism and bias. She strives to create birth equity by developing a shared clinical, research, and community solution to reduce disparities in maternal and infant mortality and morbidity, and to include fathers, importantly, in the maternal and child health conversation and policy solutions. So without further ado, I will turn it over to you, Dr. Smith. And again, please reminder, put your questions in the chat, in the Q&A, and I look forward to coming back to moderate that discussion around 6:45. Thank you.
Greetings, everyone. I'm so grateful. I think I am muted. Can you hear me?
We sure can.
Okay. Greetings, everyone. I'm so grateful to be here today and to talk with you about some work that I do in Sedgwick County with a colleague of mine, but as well as with the community, which are a vital part of this work. So I'm going to talk with you a little today about engaging diverse stakeholders of color to reduce infant mortality or birth inequities in Sedgwick County, Kansas. I am an assistant professor at the University of Kansas Medical Center, and my work, as mentioned, is focused on maternal and child health. I have no disclosures. So today I'm going to talk specifically with you about the significance of the work, the disparities, the causes, who these diverse stakeholders are and why they are very vital to this work, the work that we do, and the charge. I always like to leave these conversations with what can we do next? So I want to start by telling you a few stories. This is Shanlon, and Shanlon Irvin. You probably have heard this story before, but she was a lieutenant commander for the U.S. Public Health Services System. She was an epidemiologist for the CDC. She earned 2 master's degrees and a double PhD. She always dreamed of becoming a mom. She had a high-risk pregnancy, but she gave birth to a beautiful baby girl. A week after she was released from the hospital, she developed a small wound complication missed by the first physician, but treated well by the second physician. After she continued to feel sick and was seen by multiple physicians multiple times and suffered from high blood pressure, she continued to seek care. Her last attempt to seek care, a nurse practitioner said, "There is nothing we can do, and send her home. You just need more time." Well, guess how much time she got? She got 5 more hours that day and 4 days on life support. There is no reason why in this country we should be losing women after birth or at birth that are highly educated, have insurance. This is unheard of. We must do something. Meet Rachel. Rachel is a college-educated professional pianist who lives with her husband in the suburbs and their baby boy. The 34-year-old is fit and healthy and has good medical insurance, has a close-knit family network, but these socioeconomic advantages were not sufficient enough to insulate her from the racial disparities characterized for Americans' infants and maternal mortality rates. Rachel suffered a miscarriage, and the only person she could find to help was a Black doula. She was treated as if she didn't have these advantages when she sought treatment from her physicians. There's no reason, as I mentioned above, that in 2020 or prior to 2020 that we should be losing Black women and infants at these dire rates. There is something about being Black in America over time, perhaps generations, that leads to the worst birth outcomes for Black moms and infants. Not just in this country, but in Kansas, our maternal mortality rate for Black women is astronomical. 22.6 per 100,000 white women die of maternal mortality, but 69.8 per 100,000 Black women die in this state alone of maternal mortality. Our infants are 2.5 to 3 times more likely to die. To make this more relatable to this work, in the state of Kansas for over 30 years, Black infants have been dying at 2.5 to 3 times that of white infants. We must do something about these disparities. Specifically, the infant mortality rates are worse today than they were 15 years before the end of slavery. So what does that tell me? That tells me that we have work to do, because the reality is that my great-great-grandmother was more likely to survive birth than my niece. As an advanced country, we should not have these statistics. Each year, more than 50,000 women face life-threatening conditions during childbirth. Each day, 137 women suffer life-threatening complications from childbirth. Our Black women and Black infants are more than 3 times as likely to die at childbirth than our white counterparts. Some of the causes of maternal mortality are very complicated, but one main cause that we're focused on these days is pregnancy-related hypertension. Many of these women die from eclampsia. Well, eclampsia begins with pregnancy-related hypertension, which is simply high blood pressure that leads to preeclampsia, that then leads to eclampsia. So these women could be cured or could be treated at 16 weeks of pregnancy with 120 milligrams of aspirin. Yes, that's aspirin that we buy over the counter for less than $3. So when I came to Kansas, the thought was, what could we do? What can we do to create this safety net for our Black moms, our Black dads, and our Black infants? Where does this work begin? So the approach was that if we had healthy infants, then we could develop a community initiative of African Americans to really support this targeted population that was in dire need. And so that's what we did. We focused mostly on Sedgwick County African Americans ages 14 to 44, low income in unsafe neighborhoods. Many people said single parents and only high schoolers. But when we started to do this work, what was realized was that these are not the only individuals that are suffering from these disparities. These disparities do not have a preference for your socioeconomic status, your marital status, your insurance status, your work status, or your education status. They will not prevent you from these outcomes. So what we did was we modeled after an initiative that was in the state of Arkansas called Sisters United. And what I wanted to do was I wanted to create a group that supported our Black moms and our Black dads and Black infants and really create that safety net that was needed. And so we developed the Kansas Sisters and Brothers for Healthy Infants. What the Kansas and Sisters and Brothers for Healthy Infants are is Black fraternities and sororities working together to increase awareness around maternal and infant mortality. We've worked together for over 4 years to do this. This group comes together to be educated, to be briefed on the statistics. Why is it important that they do this work? It's important because these individuals are from those communities that have the highest infant mortality rates in this county. These individuals grew up in those communities. They have ties to those communities. They still have family and friends in those communities, and they are trusted in those communities. So we can't do the work without them because they already have trust with the population of interest. So they're able to reach that population better than we are as researchers. So we work to get these individuals together. What we did, my colleague, Dr. Michelle Redmond, and I, we sent letters to each one of the graduate chapters in Sedgwick County, Kansas, and asked them to send a representative to a meeting one Saturday in each month. We began meeting at Panera Bread. So I would go to the meeting an hour early and reserve a table for this group to meet. So this is how this initiative started. And we started by educating them on the importance of this work. These individuals are already vested in the community and do community service. So it was only the best choice to bring them together to take on this initiative. Our Sisters for Healthy Infants are our sororities, and we have members of Alpha Kappa Alpha, Delta Sigma Theta, Zeta Phi Beta, Sigma Gamma Rho that are formed together to create this awareness of infant mortality. And now we've taken on the new initiative of maternal mortality. These sorority members receive training, they use social media, they use their voices in the community to reach the target population. And they partner with other organizations so that we can link individual programs and services. Our brothers for healthy infants are our Kappas, our Omegas, and our Alphas. And they partner together not just to empower Black fathers, but to educate them on the factors that are important during birth. And so that's healthy eating, smoking, keeping a safe environment, encouraging exercise, getting rest, understanding the change, and supporting breastfeeding. Because the reality of this is that if the fathers are not supportive and educated on these manners, they cannot support the wives and the mothers on these manners. So we must begin to have the maternal and child conversation with the fathers. So some of the things that we're doing, of course, we met together at this Panera Bread for about a year, and the group came together and they said, we need to do something. We all do community initiatives each year. We all volunteer in the community and we all have our own strategy and we all focus in one area, but we've never done anything together. And so in order for us to reach the community, we have to do something together. So we started to develop this work around what could we do in our community every year. We do celebrate Day 366 and celebrate Day 366.
I need to get away from this computer for a little bit.
Was an opportunity for us to really have a celebration. So we were changing the conversation from death to celebration. Why? Because it was important. It's also an opportunity for us to educate the community on what we mean when we say infant mortality, what we mean when we say maternal mortality, and what that means to the community. It's also an opportunity to talk about co-parenting and the importance of fatherhood. This is our opportunity to not only just come together and educate the community, but to celebrate every Black baby in our community that lives past that 365-day mark. So at the end of this event, we have a celebration for them. The next thing that we're doing together as a whole is we're building a birth equity network. This birth equity network will allow us to recruit other partners such as faith-based organizations and other community organizations that have the same goals and missions or share these goals and missions with us to really create a group of diverse stakeholders that are trained in PCOR and comparative effectiveness research to really educate them on the problems and what we can do as a group. And as a part of that network, we plan to develop a shared community, academic, and clinical research agenda to implement in our county. But in order to do that, we started with collecting Black women voices. So for our Celebrate Day 366, it is really a community birthday party to celebrate Black babies living past the 365-day mark. So each year we talk about the infant mortality rate. But our event, we don't just talk about the infant mortality rate. At our event, we talk about the infants that have lived past that 365 days. We provide each family with all of the resources that we can think of or that the community has mentioned to us that is needed so that these babies can live past that 365-day mark. We provide education, we conduct community conversations on birth equity, we provide incentives, and we do the birthday party at the end. And each year we have a wall of fame, and that wall of fame includes a name and all of the names of those babies that have lived past that 365-day mark. And many of you may be asking, why is this event so important to this work? The reason it's so important is because when we started this work, according to the data, we were going to work on prenatal care. How do we make sure that Black women are seeking early prenatal care? But when we talk to Black women and when we talk to Black men in the community, they had no idea that the infant mortality rate was as high as it was, that it was a problem. They have no idea that the maternal mortality rate is as high as it is, or that it is a problem. They do know stories, but they don't know the statistics, and they don't know what that means for their community. And so this was our opportunity as a group to invest in our community, to teach them and to empower them so that they can be advocates for themselves. And so that we also can be advocates for them, we will know how to serve them. So that's the importance of this event. The importance is, let's change that conversation. So I mentioned earlier that we often talk about the rates. We always talk about Black infants dying at 2.5 to 3 times that of white infants. But we never talk about the Black infants that live. We never celebrate the birth of those. And so this is changing that conversation from death and rates to life, because every baby, every mom deserves to celebrate their first birthday, the baby's first birthday in this country. So we do the empowerment sessions, as I mentioned, we do the birth equity conversation, and we do the community birthday party. And how we provide those resources is we have vendors each year that provide resources for the community. And those resources are from services that are in the community for infants, services that are in the community for fathers, services that are in the community for mothers. They include workforce services, college, home purchasing, banks. So we try to partner with every organization that we've been told from our community or that we know of that would help to empower these families to create that safe environment for their infants. So the first thing we did was we really looked at what we're doing within Celebrate Day 366. So we do a pre and post survey each year to really gain the community's perspective on what we're doing and how important it is to them. And so we really try to really understand the demographics of who we're serving, the satisfaction of those, and what the perception of birth inequities are. And so we do a pre-post survey. That pre-survey is given at the beginning of this event, and the post is given at the end of this event. And so I have some preliminary data for that. And so each year we service about anywhere from 29 to 75 individuals, and we don't get everybody to complete a survey, although we'd like to. We really look at a majority of our individuals that attend this event are female, their mothers, are their mothers to be, and we also include fathers in that. So each year we're growing in who we reach. We have our empowerment sessions, and we ask them whether or not they are satisfied with that work. And so far, 91.3% have been satisfied with understanding infant mortality and what it means to our community, as well as 95.7% have been satisfied with the benefits of co-parenting and fatherhood. In 2017, over 50 people attended the event and 24 responded to the satisfaction survey. In 2018, 93 people attended the event and 34 responded. Prior to the 2017 event, 50% indicated they were not informed about this information. 95% indicated that they had increased knowledge on infant mortality. 61 felt that they increased their knowledge on the available resources within the community, because it's important to us that we are able to share with them what community resources are available. We cannot continue to tell parents that we have these problems, but not provide the resources that they need to overcome those issues. 87% indicated they would share the information learned with someone in the future. And so it's important to us that these individuals take this information to their communities and educate others. A significant number of comments from the participants was that they would do diet and exercise, that they were not stressed, that they would not drink or smoke, and that they would take prenatal care vitamins, which are really strategies to prevent these outcomes. So one thing that we're doing is that we're focusing on birth equity. And so the Kansas System Brothers for Healthy Infants role in doing that has been several different factors or several different things. One thing that we did is we collected Black mothers' voices. The other is we did a Juneteenth panel where we talked about how these issues of systemic racism and racial discrimination were related to these outcomes and mothers' experiences. And then just recently, last Saturday, we did our 4th annual Celebrate 366 event, which is a virtual event, and that was focused on the state of Black mothers, fathers, and infants in Kansas. So we do this together. And when we talk about achieving equity, we don't mean that every person gets the same thing. This achievement of equity means that those that need more get more. And right now, our Black moms and our Black fathers need more. Even though our research tells us that Black fathers are more involved than any other fathers in this country, the CDC study told us that there is still a stereotype placed on our Black families that these outcomes only happen to single parents, that they happen because the Black fathers are not present, and that is not true. So we've started the birth equity conversations really on concerns of challenges and how do we achieve this across our state, really looking at all of the components, all of the issues within our community, not just our healthcare system, which is very important to this, but looking at transportation, employment, housing, mental health. What are some of the limited resources? What are the limited community capacity to support fathers? How do we begin to change this conversation that only focuses on the mother and the child, so MCH, maternal and child health, to include paternal health? Fathers are an important part of the conversation. Why have they been left out for so many years? So the first thing that we did was we wanted to really talk to our community to find out what were some of the stories out there. What are some of the untold stories? How do we share this information? Well, because of COVID-19, we couldn't talk to them directly, but we created a survey to collect Black voices. And in that survey, we looked at these voices in several different categories. First, we looked at what happens in prenatal care, what happens in birth, what happens in postpartum, and how is birth equity defined within themselves and their stories. And we didn't talk to them about what birth equity means. We asked questions that were focused on birth equity, like how are you treated by other social services agencies? How are you treated, and how are you, how does the treatment you receive within the community impact you? What can our community do to better support you? That is some of the birth equity questions that we asked these individuals. So some of the common themes was satisfaction of care, birth experiences, postpartum depression, and birth equity. And I don't want to go through each quote and read that to you, but I'll just highlight some of those very important quotes because these women did share their stories with us and they were very powerful with the experiences that they've had. So 32% were never asked if they were satisfied with their care that they received. So we asked them the question, did anyone ever ask you whether or not you were satisfied with the care you received? And we were trying to really drive to whether or not they were receiving quality care. We know that when we seek many things in this country, we get a satisfaction survey, right? But no one ever asks us if we're satisfied with our prenatal care, if we're satisfied with birth, at birth, when we give birth. if we're satisfied with any postpartum treatment, or if we're satisfied with the treatment that we receive within our communities. 26% expressed satisfaction of care with their physicians, but were unsatisfied with the way clinic staff treated them. So it doesn't just stop with our physicians, but our front desk people matter to these individuals and their care. Some women detailed negative experiences from their physicians and other staff, such as nurses and receptions. One woman stated she, the doctor, turned a deaf ear to my need for help. Two women said, I received a lot of biased questions. I was married and the doctor assumed I was a single mother. One woman stated, I felt no enthusiasm from the staff. It was if they didn't like me. Another woman stated, I waited 3 hours before receiving treatment. So when birth experiences, 58% reported complications with their birth, their pregnancy, and some of them were preeclampsia. 37% elaborated on their delivery, excruciating pain, fibroids, high blood pressure, emergency and unwanted C-sections. One woman stated, both of my children were born naturally, but my second was an emergency. And after the baby was born, we were left alone in the hallway for about an hour. Another woman stated, I noticed they treated me and my husband very badly. We had to continuously tell the hospital staff my birth, and they kept trying to push their agendas. So looking at the experiences, which we know can be very questionable in these areas, one woman stated jokes were made about the father being present and time for him not being present. In 2012, a nurse told me I had the most beautiful colored baby born that day. Another woman stated, my husband at the time was never addressed at any of the doctor's appointments. They treated him as if he had nothing to do with me being pregnant. One father stated in the mother's survey, when we were in there, the doctor really wasn't paying attention to her, my wife. And you know, me being a Black man, I can't go off on the doctor because then I'm perpetuating some stereotype. And next thing you know, I'll be kicked out of the hospital or worse. So for postpartum, 42% reported postpartum depression, whether it was anxiety, lack of energy and motivation, loss of identity, and feelings of failure. One woman stated, I experienced postpartum at all 5 births. It was worse with the help of a few people in my community and a different community resource. I was able to persevere. Another woman stated, I stayed in denial most of the time. In the Black community, mental issues are frowned upon. So you stay strong and push through. You're okay. You have to take care of that baby because nobody else is going to do it. In birth equity, this was really important to us. So when we talked about what birth equity means, the participants stated listening and meeting patients' needs, more information about prenatal care and postnatal, including fathers, which we've been trying to do for 4 years, and professional counseling. One person said, listen to Black women, acknowledge the Black man that's in the room. Just listen to the Black woman, and that's it. That's all you got to do. If a Black woman is saying something is going on, listen to her. Take it seriously. That is all, and that is it. And that is advice from a clinician. Another woman stated, which was very powerful, she stated, stop judging based on the racist scientific medicine. Believe our pain and concerns. Had my first pregnancy, OBGYN didn't judge me, he wouldn't have assumed, and I quote, that I was a big girl, strong. I thought you'd be able to pop him out with no problem. Your statute says it should have been no time. Sometimes bad things happen to good people. In taking action, one woman stated, we specifically need to look at giving Black women support and Black baby support. We need to support lactation. We need to support physiologic birth, and we need that wraparound support within the community. Another woman stated, we need advocates at every level. When I was on the table being cut open by my doctor, a nurse rushed in to stop the procedure to hand me a big, nasty telephone as I laid on the table being cut open to get my child, whose heart rate was dropping. It was an emergency. She brought me a phone to let me know that the procedure could not go on until I had a doctor on file who would take the medical card. So these diverse stakeholders are...
Dr. Smith, we have about one more minute and then we'll move into Q&A.
Okay.
Thank you.
These diverse stakeholders are not just important in the work that we do around this issue, but they're important because a lot of these stories that I shared, they come directly from these diverse stakeholders who are mothers and fathers in our community. We have excellent collaboration when we talk with them. So we evaluated what does it mean to these stakeholders and what are they saying about this work? We're on our 4th year of this work. They said we have excellent collaboration and benefits for the community. For the Celebrate Day 366 event, they thought that we were uniquely situated to address poor Black outcomes. For our future KBN, which is our Kansas Birth Equity Network that we're developing, they thought we needed to develop a tangible intervention on each level. For example, addressing implicit bias training for physicians or how to advocate when we're at our doctors. So I'll end by saying just what we can do as individuals. One is embrace the concept of community action. Give Black women a seat at the table. We're collecting their voices, but in our work, Black women who have experienced these issues and Black men need to have a seat at the table to do this work with us. Can we do this work? Yes, but we cannot do it without them. Think of birth equity not only as a process, but as an outcome, and we must examine organizational policies and traditions that create and embrace systemic racism. We must stop relying on a system that was built to oppress these individuals to provide the care that they need. It must come from us, and we must work together to achieve that. Any questions? Thank you so much.
Thank you so much, Dr. Smith. You did perfect in terms of timing. So thank you so much. And such a wealth of information and really inspiring community-led work that you're doing. I love that you took, fraternities and sororities that were already engaged in civic engagement and kind of, activated them in a new way, the involvement of fathers, the focus on positivity, and the outcomes speak for themselves. You are literally changing family by family in your community. So you're so inspiring. So we have a couple questions that I'll go through and then we'll wrap up in about 6-7 minutes. So please get your questions in. I see that we have a couple people sent them directly to me, so I'm going to read them aloud to you. So the first is, I love your refocus on positive outcomes as opposed to the dire statistics that scare most of us. It seems the negative statistics get all the attention though. So when you're doing your research and your policy work, how do you balance that need to focus on kind of the positive outcomes, the babies that live, the families that are thriving, the celebration side, with the dire statistics and sort of the, the scariness of it all, and you're a Black woman yourself. How do you balance that in both your research work and in your policy advocacy work?
Yeah, that's a great question. I'm not sure that I have completely been able to achieve that balance. I do often start with the daring statistics. So the startling statistics, I start my conversation with that, talking about how these rates are worse today than they were 15 years before the end of slavery, to gather the attention of the individuals that I'm talking to. And then I lead to, but this is what we are trying to do. And this is the next step of that. And then we try to change this conversation from death to celebration. But we don't have the statistics of how many survive. Like nobody puts those statistics out, right? And so this event is the only thing that we have. And if they're not participating, I can't really come up with rates to say, well, we celebrate, these rates every year. My idea is that rather than us saying we lose 250 babies in Kansas every year, I want this event to get to a point where we talk about the fact that 250 babies have survived each year. So my goal is to grow it so that we have those numbers to really prove these things are happening. The other thing that I've not done well is advertise what I'm doing. Although I recruit individuals to attend the event, I don't put enough attention locally or nationally on the great work that this group is doing. And so I'm changing that to really include, newspaper articles with different organizations, as well as within the state, so that they know that there is a group of individuals that work hard with me every week, every month. They volunteer their time to do this work, and they are more into the statistics than any of us are. Like, they are more into this work because to them, it's their personal story, right? Many of these individuals have experienced this. So this is their personal story, and they feel they need to do something. So I don't know if I've found that balance, but I'm definitely trying to get there. I think you're on mute, Katie.
I am on mute. Oops. All right, I'm back. So the next question comes from the chat. I said, thank you so much. So the next question is, this is excellent work. I was wondering if other Black organizations were included, for example, the African American Eastern Stars and the Mansions. I think this speaks to your point of trying to get the word out to more groups, but what do you think about that?
Yeah, so that's a great question. We started this initiative with the African American or Black fraternities and sorority. They're graduate chapter members, so they're in their careers, they're professionals. Many of them are in the clinical field, of course. But the idea behind the Kansas Birth Equity Network, which we are beginning in January, is to include all of these diverse stakeholders. So we're now recruiting faith-based organizations, diverse physicians, diverse nurse practitioners, doulas, midwives, and all other organizations that service these individuals. We're including that, as well as our DCF. So we're including some DCF. I have a couple of legislatures that will be a part of this network. Of course, they won't be able to attend every meeting, but we must reach everyone at every level. So at this stage, we are including those other diverse stakeholders.
That's wonderful. And I think you hit on a key theme of a lot of the work that we've been talking about in the first symposium meeting and in this one, which is interdisciplinary collaboration. The importance of bringing researchers such as yourselves, people with lived experience, midwives, doctors, specialists, hospital administrators, doulas, nurses, folks who have leadership in the faith-based community, in the fraternity, sorority, all these different community leadership roles all need to come together. This is a family issue, and everyone who has a stake in family well-being really does need to come together. And I do think that's, you've really hit on the glue of successful advocacy, is when you can bring all those different people together. It sounds like you're well on your way to doing it. So thank you. I have one more question and then we'll wrap up. It's a simple one, simple and big one, which is, what's your biggest challenge? I know you spoke about a couple things about getting the word out, and obviously, I'm sure kind of time and bandwidth probably plays in there too, but what are your biggest challenges in doing this work in your community?
I think my biggest challenge is that this work is very laboring, and a lot of that isn't rewarded within the system that I work and live in every day. So if I'm doing advocacy work that's not really funded by my research, my work is focused on getting grants, doing interventions, and making a change in this outcome, because I was recruited to address African American infant mortality. So my work is really focused on the goal. Like, my work is focused on the goal, and in my heart of hearts, I want to strengthen Black families, right? And so, but that work has different layers. And so I think my most challenging issue is balancing my time, but also making sure that I make a difference. So a lot of time that I put into this work is not a part of the job that I do every day, but it's what's needed to make a difference.
Well, on that note, I would like just to take a minute together to share some space together, because as you so eloquently said, this work is laboring. I'm a survivor of a postpartum hemorrhage. And every time we do this work, it's emotionally laboring, it's hard. And so I just want to take a minute together to just take a breath, just sort of, you think about the work that we do and our call to advocacy and the quotes that Dr. Smith shared and your own work. for you to take a breath too after sharing that with us, just to do that. I know I'm on the East Coast, so it's getting late. I'll transition to putting my kids to bed in a couple of minutes, but just wanted to hold some space together. And thank you for all of you for joining this meeting. So please, if you have any other questions, put them in the chat, but just wanted to take a minute to hold some space together, take some deep breaths together, and just be grateful for each other and the work that we do together, and acknowledge that it is hard, that it is laboring, and it is deeply emotional for all of us in so many different ways. So thank you, Dr. Smith. I'm also a yoga teacher, so I do a lot of deep breathing. I'm working on my doula certification, but I thank you so much, and thank you all for joining. But please chime in if you have any other last questions. We have another minute or two, and please take some space for yourself.
Thank you. And thank you guys all for coming in. I want to give a special thanks to the group that works with me here in Sedgwick County, Kansas, the African American fraternities and sororities that support this work.
Thank you so much, Dr. Smith and Katie. Dr. Smith, that presentation was incredible, and I want to thank you and everyone you work with for doing such amazing and powerful work for the health of generations of Black families to come. So